Ovarian cancer, signs and symptoms, how do we treat it, and what does it look inside the abdomen? This is Dr. Samar Nahas, a gynae-oncologist and a minimally invasive surgeon. The reason why we detect most patients late is in the beginning stages of the disease, patients have no symptoms, or they have generalized symptoms like nausea, vomiting, fatigue, but really nothing specific to alert them to go see their physician. Or sometimes they go to their doctor, but they are reassured that everything is okay with them. By the time we see them, 85% of the patients have disease in the pelvic area, upper abdomen, and fluid in the abdomen. We call it ascites, that affects their ability to eat, cause them to be weak, malnourished, and usually in a poor health kind of situation. How do we decide who received what treatment is based on the amount of the bulk of the disease. So if we think that we can take the patient to the OR and completely take the disease away and clean it up, definitely we call it a primary debulking surgery, and definitely that's the route that we prefer because it has a better outcome. But if we think that we cannot completely debulk the disease by taking them to surgery because it involves organs that we cannot remove, then we give them some chemotherapy up front. We call it neoadjuvant chemotherapy. If they responded, we do surgery to clean up the tumor, and then we give them some more chemo. I'll show you some videos to show you what does it look inside the abdomen. Usually there is an ovarian mass in one ovary or both ovary, which is kind of a bulk. Instead of the ovary being small, it is larger and doesn't really look smooth. It looks usually tethered and stuck to the surrounding structures. Sometimes there's a plaque of tumor or disease on the peritoneal cavity or the surface area of the pelvic and abdomen. We call it peritoneal carcinomatosis. Sometimes separate nodules all along the pelvic area and upper abdomen. And a very common location is the omentum, which is a fat pad that comes that hangs from the transfer colon into the abdomen. That's a very common site, and if it's involved with the disease, it replaces the omentum with a bulky plaque of tumor. We call it on imaging omental cake. No, it's not a cake. It's an ugly disease that we need to clean up. So I'll show you in the following video what it looks inside the patient's abdomen. Follow me. Showing now the surgical video where we did debulking for ovarian cancer. This is us doing it minimally invasive, creating